Hi guys, thanks for coming in today.
Hi.
Okay, so we're gonna start with a couple of questions. Can you tell me your name and age?
Yeah, my name's Jake. I'm 18.
Okay. And can you tell me where we are right now?
We're in Dr. Snyder's office.
Okay. And can you tell me why you're here right now?
I don't know, my mom brought me in for some reason.
Okay. Can you pick up that pen right there?
Yeah,
Can you put it back down? And can you fold that paper in half?
yeah, I can fold a piece of paper, I'm not stupid.
Okay. Can you remember 3 words for later? Candle, table, chair.
Candle, table, chair.
Okay, good. Okay, so you said you didn't know why you were here today. Can you tell me why you brought him in?
He had been getting in trouble with like stealing and getting in fights, and so the court said we should bring him into a mental health professional. But this has been happening like forever, so I think he should have came in earlier, but he refused.
Okay, let's talk about that. How were you in school? What was that like for you?
I mean, school's okay. I graduated high school recently, but I don't know, I just don't care. It's an environment I just don't want to be in.
Alright. When he was a kid, like we're talking elementary, middle school, what was he like with his teachers, his classmates?
Well, he would like get in trouble for like stealing their things and stuff, but like we thought that was just like okay at first because you know little boys would be boys, but then it got to be a problem, and so he had to be like separated from his classmates and.
Okay. Do you have any history of drug use?
I mean, I started smoking a little bit of dope, and I recently tried cocaine.
Okay.
Yeah, it's just something I've been doing with my friends sometimes, you know.
How old were you when you started smoking?
I think I first picked up a joint when I was probably like 12 or so.
Okay. Do you have any history of violence, especially when you were younger? We're talking like before 18.
Yeah. I mean, ever since I can remember, I'd be getting in fights with kids in pre-K, you know. Kids would just tick me off and I'd just go off on them, you know.
Do you feel like they deserved it, or?
Yeah, of course they deserved it. But I mean, I don't care. I just, you know, if you're gonna disrespect me, I gotta show them who's boss.
Okay. And what about destruction of property? Were you someone to break things when you were younger?
I mean, yeah, if someone ticked me off, you know, an eye for an eye, I gotta do something back to them. Sometimes that means breaking their stuff.
Okay. And did you ever feel bad afterwards?
No, of course not. They deserved it. I don't care about them.
Okay.
You know, it doesn't matter to me.
Alright, what about home life when he was younger? Did he act like that at home too?
Yeah, of course. Like he'd even come after me and like his other sibling.
Okay.
And he just wouldn't care. And like I tried to punish him, but it didn't help.
Alright. What about, did you guys have any pets?
Yeah, we had a cat, but not for long, so we had to get rid of it.
That cat didn't know what was coming to him. I hated that cat.
Can you tell me a little more about that?
I mean, it just wouldn't stop meowing sometimes. She was at work. I guess I had to feed it or something, but it just wouldn't shut up. So I kicked it a few times. You know,
Okay. And did you feel bad? Was it your cat?
Yeah, it was like originally my cat, but I wanted like the kids to get like involved in like the cat's life, and so I gave him the job of feeding it while I was at work.
Right.
And one day he just like stopped feeding it like for a whole week, and I was like wondering what's going on, and so I asked him about it, and he just lied and like was like, no, I'm feeding the cat, I don't know what you're talking about, and it just became a huge fight, so we just had to get rid of it.
Okay. Do you have anything else outstanding from when he was younger that you'd like to talk about?
I mean, he wouldn't even like respect his teachers or anyone like that because he didn't have any like respect for authority figures.
Okay, alright. Okay, so let's just take a minute to talk about yourself now. Have you ever self-harmed in the past or ever thought about it?
No, definitely not.
What about thoughts of suicide?
No. Why would I need to do that? Why would I rid the world of me?
Okay, and is there any history of suicide in the family?
No.
Alright. And if you ever had thoughts of suicide in the future, do you have anyone else you could talk to besides either your mom or myself or a friend?
I mean, I guess I could, but I don't really see that happening.
Okay.
What's with all these questions? Like, I'm not crazy like that guy out there in the waiting room. What was his name? Don?
Hey, stop, he's just bohemian.
Okay, so let's talk about your relationships with people. Do you have any close friends, any girlfriends or boyfriends?
Yeah, I mean, I have a few friends, I guess, if you could call them that. I don't know. I get into fights with them a lot. I had a few girlfriends, but none of them really stuck around. I mean, I don't think I really need anyone other than myself.
Okay. So would you say these were serious relationships, or?
No, not really. None of them got too serious. I mean, I'd have a girl with me, just 'cause sometimes, but
Okay.
it was nothing really, anything more than that.
Okay, and then have you noticed anything interesting about how he interacts with people?
Yeah, he's very charming, like at first, so that people like him, and like he gains their trust. But then he always just ends up doing something for his own gain. And
Okay.
he's very like manipulative and just
Okay.
not very well with people.
Okay. Okay, so in the way of just behavior in general, does he participate in anything that you would consider like risky behavior?
Driving especially. Like I don't like him to drive with me in the car because it's just crazy and I can't handle it.
Okay. Can you tell me about that?
I mean, I'll get pulled over from time to time, but like, I don't know, I've gotten a few tickets. I just don't see like why I have to follow the speed limit, I gotta get where I'm going. I just don't really care.
Okay. And how would you feel if somebody else on the road crashed because of how you were driving?
I-
Anything?
I don't really care. It doesn't matter to me, I gotta go where I'm going, they gotta fend for themselves,
Even if it was a family member that you hurt?
Yeah, I mean, I don't care.
Okay.
I gotta go where I'm going.
All right. And in the way of others, would you ever consider harming anyone else? Anyone in specific that you've been thinking about?
I mean, like I said, like, if someone ticked me off enough, I would definitely consider hurting them, and I have before. I've sent people to the hospital before because, I beat them up so bad because they were asking for it,
Can you tell me about that specific instance?
Yeah, I mean, one time I was like 15, and I had a crush on this girl, and this guy was talking to her, and I mean, I don't know if they were really flirting, but I just got so mad, and I just started wailing on the kid, and they had to get like 4 teachers to break us apart. I ended up breaking the kid's nose, and he was in the hospital for a few weeks. So.
Did you feel bad about it afterwards?
No, not at all. He shouldn't have been talking to the girl I liked. Like what is that?
Okay. And as of now, is there anyone you plan to harm? Do you have a plan in place of how you would do it, or is it just more of a if the time comes kind of thing?
Yeah, I mean, like, I don't know. There's no one in specific I'm thinking of, like, right now that I would, like, go out and hurt. But, at any time, if someone takes me off, I'll do it.
Okay. And can you repeat the words from earlier that I asked you to remember?
It was candle, table, and chair.
Okay, thank you.
Yep.
The patient shows signs of antisocial personality disorder, and based on testimony from patient and parent, there appears to be previous conduct disorder in their childhood. The patient is times 4 oriented and shows no immediate suicide threat or specific harm to others. Future plan of action includes weekly talk therapy and working on coping mechanisms for undesired behaviors.